Hey everyone, my name's Brandon. I'm a registered nurse and I'm on the autism spectrum. I want to talk today about what it was like going through nursing school. Perhaps you're considering going through nursing school and you too are on the autism spectrum. Now, of course, those of us that are on the autism spectrum, we fall all over the continuum. Some of us are affected more severely than others. And so in my case, I feel very grateful for the fact that I was able to make it through nursing school, and I have been working as a nurse for about 11 years. So I do want to kind of explain a little bit about before nursing school. Prior to nursing school, I was in public school all the way from kindergarten all the way through the 6th grade. And then from 7th grade all the way till 12th grade, I did homeschool. After that, I worked for my father doing construction. After that, I decided that I wanted to pursue a different career. I studied for pharmacy technician, and I memorized everything I needed to know within a 3-month period. I did it self-study, and I got a job in retail pharmacy. And as you who have already seen one of my previous videos, it was the worst job I ever had, and that's kind of what triggered me down the path towards finding out that I was on the spectrum. Now, after that, I got a great job working in a hospital setting as a pharmacy technician, and I'm so grateful to have had that opportunity. Opened a lot of doors for me. I still work for the same company 16 years later. In that time period, I found out that they had a nursing program. It was an associate degree of nursing. So with the associate degree of nursing that I got at a community college, the place I worked at paid for the entire program, and that was one reason I chose it. I also was kind of inspired because I remember we had a career day at the community college I was taking some prerequisites at, and they had what was called care flight. So it was registered nurses who ride in a helicopter and they rescue people. So it's kind of like emergency medical service, however, with a helicopter. I was so excited when I saw that. I thought that is exactly what I want to do. So I decided to go on the path to achieve that goal. I applied to the nursing school that my hospital had a contract with. And prior to nursing school, you have to take a bunch of prerequisites. So it's like math and psychology, some sciences, English, and a bunch of other classes. Once you have all those done, then you do 2 years of nursing school once you get approved into the program. And it's pretty competitive, but I got in on the first try, and I had pretty good grades on my prerequisites. Now, I was fortunate with getting my prerequisites. I was able to get them all at a community college, and I'd applied for some grants, and so those classes were all paid for. So I managed to make it all the way through nursing school without having to pay any money. Once I got into the nursing program that my hospital was contracted with, I had to sign a contract that once I graduated as a registered nurse, I would continue to work for them as a registered nurse for 2 years, basically in compensation for going through their nursing program. And I was very grateful for that because that kind of it made it easier for me when it came to the whole job searching process, because hey, they want me to work for them, so it was a lot easier to find a job. So that's a little bit about my story about up to the nursing program. Now, in nursing school, you have two main things. You've got didactic, so it's like a lot of lectures, and I was in a hybrid program. They had just gone live with a hybrid program, which meant some of the lectures were recorded online and some of the lectures were in person. And the advantage to them being online was you could watch the lectures as many times as you wanted to, rewind, fast forward, take notes, that sort of thing. The classroom setting was a real struggle for me. So being on the spectrum, I get distracted extremely easily. Just someone coughing behind me, or I could even hear a person's pencil writing on paper, and it would just be very distracting for me. I would be in a train of thought trying to listen to the instructor, and all of a sudden someone would ask a question and it would totally get me off guard. And then it was real hard to get me back on track. Kind of what I started finding was I really needed to prepare super well, more than usual, before the classes even started. That way I knew all the material in mind, and that way when the teacher was talking about these things, it was a lot easier for me to keep up, but it was still a struggle. I think the most stressful thing for me in the didactic portion of nursing school was tests. I had horrible test taking anxiety. It wasn't that I didn't know the information all the time. A lot of it was just the fact that it was a test and I was having to take it in a room with 40 other people and hearing them chewing gum, coughing, sniffing, the pencil writing on the paper. It was very, very difficult for me to focus on the test. If you were to ask me the questions offline that were on the test, many times I could have answered them just fine. But being in that arena of a classroom with all these noises going on and all that pressure, it was very difficult for me to perform at my best. And I was not diagnosed with being on the spectrum at that time. I knew there was something going on. I knew I had panic disorder. I knew I had depression. And so I tried to go through the school and find out there's a way that I could get an accommodation made so that I could take my tests in a quiet room. So they do have that ability where they can put you in a quiet room with nobody else in there, and it's like soundproofed. And the only way to do that is you have to go see a psychiatrist. Well, I didn't have the money for that, to get diagnosed and get a letter from them saying that I needed to have a quiet room. So I just grinned and bared it and I got through it. But I remember having horrible, horrible panic attacks when I would take these tests. I remember, and this wasn't the only time, but there was my second semester was extremely difficult. I had a difficult teacher, and I don't want to be bad-mouthing anybody, but I will say that was probably the worst semester of my entire nursing program. And the entire nursing class really struggled. It was so bad that 50% of the class ended up failing and having to repeat the class. Thankfully, I wasn't one of them. I just barely got by. I made good enough grades to where it wasn't going to hold me back. So that was a horrible, horrible semester. I wasn't really interested in the material either because it was all women's services and babies and children, and I was not planning on working in that area. So a lot of the stuff just kind of went over my head. That wasn't a strong area for me. Now, my semester before that, I made straight A's. I had a 4.0. But that second semester, I made a C in the didactic, a high C. I almost made a B. And also the school I went to, their grading criteria was a lot more difficult. So it was a lot harder to get an A or to get a B. And pretty much what they say is like, if you were getting A's in regular school, plan on getting B's in nursing school. If you were getting B's in regular school, regular college, then plan on getting C's. If you're getting C's, plan on getting failing grades. So, I made really good grades with my prerequisites, but nursing school was more of a challenge. Now, the other side of it was clinical. So with clinical, that wasn't so hard. It was more of a hands-on thing, but the hard part about that is being on the spectrum, there is a lot of patient interaction. And so I had not really worked in that kind of an environment before, and so there was a whole lot of firsts for me. I remember the first time I had to put a person on the bedpan. I mean, I was jumping up and down, so ecstatic and excited because I put someone on a bedpan. And my teacher still remembers that. She said, "Oh, I tell people all the time about Brandon as a baby nurse, and the first time he put someone on a bedpan, he made such a big deal out of it." In a nursing environment, the patients are in a very vulnerable state. So, you're giving a bath to a patient and they're naked. And imagine that's already hard for a guy having to do that, and then imagine being on the spectrum, how much more difficult that is. But I think in my mind, I just knew I had to push through, and I knew I had to be successful, and I couldn't make any excuses. So I really, really pushed myself. And I did it, and I was so proud of myself when I made it through it. And now looking back, knowing what I know now, I'm even more proud of myself that I was able to do that, because I was on the spectrum the whole time and I had no idea. I just thought I just had anxiety. Test taking was really tough. I kind of mentioned about that a little bit earlier. So with tests, I remember there was a day, this is probably one of the worst experiences for me, that second semester I was mentioning that I was struggling with. Just the sounds in that room were so loud, like people writing, like filling in the bubble with the pencil. I could hear the lead being scratched on the paper. And so This is not the only time I did this. In my head, I was imagining freaking out and just throwing the paper up in the air, shredding the test to pieces and saying, forget it, I'm giving up on nursing school. I had that happen so many times, but I managed to control myself and just push through. So it was tough. Hopefully that gives you a little idea if y'all are on the spectrum and you're thinking about nursing school, just kind of what to expect. What I will say though is, if you know you're on the spectrum, that's something that you have as an advantage ahead of me, because if you're on the spectrum, then you can apply for accommodations. You can take your tests in a quiet room. You can do it with like no time limit. One of the things I did do that really helped was, because the noises were so bad, is I would bring, you know those headphones that you wear at the gun shooting range? I would bring gun shooting range headphones, and I would bring those waxy earplugs like you wear when you're going to go swimming. So I put the headgear on my ears so that that would block out the sound. But then I could hear like my jaw moving and my joints moving and my heart beating, but it was a lot better than having to listen to, you know, the squeaking of the chair and people writing and people talking and all that sort of thing. So another thing that I did to kind of help myself out was I could not study in groups. It was impossible. I couldn't get anything out of it. So I had to study on my own, and I had to study extremely hard. Another thing that I did was making sure that I wrote down every single thing that was unfamiliar to me. So if the teacher mentioned something like, let's say they were talking about pulmonary hypertension, and I wasn't familiar with that, then I would go online after school and I would look up all those terms, and YouTube was my friend. Oh my goodness, I watched so many YouTube videos, and those things that I did look up on YouTube and in the books, those are the things I made the best grades on. To be honest, in nursing school, it is not possible to memorize every single thing that they're telling you in the class. And it is not possible to read everything that's in the books. The secret is learning what to read and learning how to study. When you hear a term you're not familiar with, write those things down. That way you're not wasting your time with the stuff that you're a little bit more familiar with. And a lot of times the teachers are talking about things that are going to be on the exam. So after that, I got my degree and I got my license, and I worked for probably about 2 years. And then I went and got my Bachelor of Science in Nursing, and I did that completely online, and that wasn't a problem for me actually, because I didn't have to deal with any people. It was recorded lectures and just a lot of busy paperwork. I made it, I graduated, so hopefully that's encouraging to some of y'all, and it might inspire y'all to consider, you know, trying to be a nurse if that's something that you wanted to do. I will say I felt like really stupid in nursing school. I thought they're gonna figure out that I'm really, really dumb. I had very low self-esteem. And so I remember as a brand new nurse, I would look at these nurses that had been nurses for, you know, 5-10 years, and I thought, oh, I can never do that. I'm gonna end up getting fired because I'm really stupid. Well, looking back at it now, I wasn't stupid. I was just intimidated. I knew the information. I didn't think I did, but I did know the information. But everybody's circumstance is different. Everybody's got kind of their skill set that they're better at. What you can do is just really think about it. Maybe you can go and volunteer at a hospital and see what it's like being a registered nurse. See if that's something that you want to do. So if you'd like to get more content, feel free to subscribe, put your comments below, and make sure to like the video. Take care.